we have interesting case. I get a lot of travel marks, so Africa keeps me busy. And now I have somebody from Kenya, and he's 28 years old now, but when he was very young, very little, he had the travel marks, and he has all over, but you know, this is the bad one right close to the hairline here, and it looks strange, and we want to make it look like a straight line so that he doesn't have to hide it all the time. And I wanted to show you what it looks like, so let's take a look at the Q-tip. I want to point it out. So as you can see right here, so this is almost like a burn. This is almost like a burn, and that's what I think it was, a burn, because it's depressed as well. So we have to cut it and make it an ellipse from here to here to make it a fine line that finally starts blending into the natural lines. I'm going to have the patient raise his eyebrows so you can see how he has these lines, right? It's never going to be as good as these lines, but as long as it is this direction, it is less likely to be noticed, and that is a goal, in this direction, as opposed to this, just like a depressed area, and you see this raised area as well. So let's get it going. Okay, so we have done the markings, and I would like to show you exactly how it is right now. So if you come closer, you'll be able to see it. I want you to show it if you want to make it 2.5, just to show the forehead, not the patient's whole face. So you can see that it's depressed. So I had to make the boundary right here. This is how big the scar is. Now, if we were just to cut this much, how are we going to close? Think of this as Burroughs triangles on the sides. Otherwise, it would be like a bulge here, bulge here. We can't do that. So we have to have the 30-degree angle here and here. This doesn't have to go this far. I think we'll stop right here and here. But that'll get rid of all this area. See, this is your scar area right there. All of this is scar. I'm going to actually put this marker to demonstrate all of the scar area right there. And then when we finish, we'll do some resurface later for the other scars as well. So that's the plan, and I showed it to the patient so he knows exactly what we're doing. Thank you. Okay, so this is the scar tissue, as you can see, and I'm going to flip it over right there. So there's a lot of scar tissue underneath right there. We have taken it all out, and then we'll be able to close it. We'll show you how it looks right now. And the dark marked area with all the scars, this is just the ellipse on the side right there. So let's go back and I'll show you the forehead right there. So you can see that right now it looks fantastic. With time it's going to keep getting better and better, and the goal is that when finally the patient raises his eyebrows, go ahead please, raise your eyebrows. Raise your eyebrows, good. That starts looking like one of those lines, and it will. But it will take time, a whole year, and lasers as well. Thank you.